Reading prescription and then validating a medication are two different things, of which you are required to do all these before you administer part 3 of reviewing candidate feedback. Hi, my name is Gentle. I talk about Osce and other stuffs relating to the process of joining the UK NMC as a nurse, midwife, or nurse associate. So, if you are preparing for your Osce, stick around and then watch this video. Make sure you share this video to other people who are also preparing to sit for the Osce. So you see this feedback up here? Yes. It's one of the feedback from a candidate who recently sat for the Osce, where the feedback says the candidate failed to perform checks on the medication they administered. Remember, I've always been saying that as a nurse and even on the clinical settings, before you administer a medication to a patient, one of the most critical things you should look at is that is there a valid prescription in place for you to administer that particular medication? If yes, then you've passed the first check to administer the medication safely to your patient. After getting to know that there's a valid prescription in place, of which in the exams there will be a valid prescription, you then proceed to validate what? The medication. That is, you need to select the right medication as what stated in the prescription. That leads us to what? Validating your medication. So in Osce, when you read the prescription and then you validate it and then you are going to pick your items, you need to also validate that medication as well. So you pick the medication, you mention the name of the medication, the expiry date, and then you acknowledge the presence of the batch number. Then you can clearly say that this medication is what? Safe, and then you are happy to give. Failure to perform these checks on the medication even before you give it is what? A fail. So you need to perform all these checks even though you have read a prescription. Reading the prescription is different from validating your medication. So make sure that whenever you are doing your examination, after reading the prescription and validating it, remember to also validate the medication you are going to give to the patient. So remember, reading prescription and then validating a medication are two different things, of which you are required to do all these before you administer the medication safely to your patient. My name is Gentle once again. If you want assistance or guide on how to write your Osce, don't forget to hit the follow button, share this video, and then send us a DM. We will help you out.